Our next speaker is Jonno White, a dynamic keynote speaker, workshop facilitator, and MC who helps leaders build workshop cultures and employees would move cities to join and customers line up to buy from. Jonno is the author of best-selling book Step Up or Step Out, with over 10,000 copies sold worldwide. His work has helped leaders across the globe manage difficult conversations and build stronger teams. He's also the host of Leadership Conversations with Jonno White podcast, and over 230 episodes and listeners in more than 150 countries, where he interviews renowned leaders like Guy Kawasaki, former chief evangelist at Apple. Jonno is the founder of 7 Questions movement, reaching over 500,000 people each year and empowering thousands of leaders around the world. Get ready for a real-world insights, fresh leadership strategies, and a whole lot of inspiration. Please welcome Jonno White.
Thank you. Cheers, Brendan. A woman is walking through the front doors of the Dana-Farber Cancer Institute in Boston. It's mid-November 1994. She's carrying a small overnight bag in one hand and a stack of research papers in the other. Because that's who she is. Most patients walk into a hospital carrying fear, but Betsy Lehman walks in carrying her homework. She spent more than a decade writing a health column for the Boston Globe called Health Sense, which means she's spent more than a decade. She's been explaining to the people of Boston exactly how hospitals can get things wrong. Drug errors, missed diagnoses, the chain of safety and every link that can break. Her columns run in 350 newspapers. She's covered everything from cutting-edge research to the finer points of bedside manner to specific ways a system designed to save your life could accidentally end it. Betsy Lehman's whole career has been built on understanding how the system can fail. She is, by any measure, the worst patient in America to accidentally kill. But she doesn't know that yet. Nobody does. She's 39 years old. She has 2 young daughters at home, Emily and Laura. Laura is 3. And what Betsy's thinking about right now, she's walking down this corridor that smells like floor polish and hand sanitizer, and she's getting through her 3rd round of treatment so she can go home and be their mum again. She has breast cancer. She's researched every option, read every paper, and picked the institution with the strongest record. Harvard Medical School is across the street. Brigham and Women's Hospital is next door. She's surrounded by some of the most concentrated medical expertise on our planet. She's in exactly the right place. In another room, a 3rd-year clinical fellow is writing her treatment order. The drug is cyclophosphamide. The protocol specifies a dose divided across 4 days. He misreads it. He writes the entire 4-day dose as her daily dose. 4 times the intended amount, every day for 4 days. The order goes to the pharmacy. A pharmacist checks it against the protocols, signs off. A second pharmacist checks it, she signs off. 2 human safety nets, one after another, both fail. Come back to Betsy's room. The IV pole is beside her bed, the fluorescent lights humming the way they always do in a hospital room, that flat hospital hum that becomes invisible after an hour. The monitors are beeping in slow, steady intervals. There's a window, and through it the grey November sky over Longwood Avenue, and somewhere out there, there's two little girls thinking their mum's getting better. A nurse walks in carrying the bag of cyclophosphamide. She checks Betsy's name, she checks the medication, she checks the dose against the physician's order, but everything matches because the order itself is wrong and nobody knows it. She hangs that bag on the IV pole and the drip begins, and this happens day after day, 4 days in a row. 4 separate nurses walk into the room, hang the bag, watch the drip, and walk out. 18 registered nurses in total involved in hanging, monitoring, taking down the chemotherapy across these 4 days. Every one of them follows the same process. Every one of them checks the dose against the order. Every one of them confirms it matches. And every one of them is confirming a match against an order that should never have been written. Come back to the room again. The lights are humming, monitors beeping, but Betsy's different now. Her blood test's abnormal. Her heart is under massive stress. The whole lining of her gut from one end to the other is shedding. She's vomiting sheets of tissue. Her husband is standing at her bedside. He can see something is deeply, obviously wrong. So he tells the doctors. They say, this is normal. Nobody walks back to check the order against the protocol. On December 3rd, 1994, Betsy Lehman's preparing to go home. She's made it through the treatment. She's close to being discharged. The overnight bag she carried in 3 weeks ago is probably sitting in the corner of the room, ready to carry back to Laura and Emily. But in that bed, in that room, she goes into cardiac arrest. She's 39 years old. When they examine her body, they find something that haunts everyone involved for the rest of their careers. There are no visible signs of breast cancer left in her body. So it seems the treatment actually had been working, and the drug that ended up killing her, if it had been in the right doses, she might have had decades left with her family on this earth. To watch Laura learn to read, to see Emily grow up, to write another decade of columns explaining to the people of Boston how to stay safe in hospitals, but nobody knows any of this yet. Because for 3 months after Betsy Lehman dies in that bed, the cause of her death was actually listed as just complications of cancer treatment. A tragic reminder of the risks of aggressive chemotherapy, sad but expected. So the file gets closed, the bed is cleaned, another patient moves into the room, and 3 months later, a data manager in the records department is doing a routine review. She opens Betsy Lehman's file, reads the dosage order, reads it again, 4 times the intended dose, written on a piece of paper, somehow passed through every safety checkpoint in that building. Administered to a woman who's now been dead for 3 months. So when the story breaks, it breaks hard. 350 newspapers. The Boston Globe has to write about it because it's one of their own people. So Dana-Farber is put on probation. The president, the chief medical officer, virtually everyone in authority when it happened is eventually gone. But I keep coming back to that room. The fluorescent lights humming, the monitors beeping, that IV pole with a bag that should never have been hung. A woman walking in with a stack of research papers thinking she's going home to her daughters. She knew more about hospital failures than probably anyone else in the building. She chose the best hospital in her country, surrounded by Harvard doctors, double-check systems, protocols designed for exactly this happening. And none of it saved her. Because the chain of safety is only as strong as the moment nobody thinks to check. And so today what I want to talk about is the people in whom critical knowledge lives. The risks that maybe nobody sees, and why sometimes the most dangerous threats to the systems that you're a part of can't just be solved with better engineering. My name is Jonno White, as Brendan said, and I'm the author of Step Up or Step Out, which really looks at how do you deal with conflict better. How do you, because I've done it terribly myself. So I've sold 10,000 copies around the world. I host the Leadership Conversations podcast, and I spend every day working with leaders, working with teams to help build the type of culture that people would move cities to work in, because they hear about your culture and they think, man, I would love to be part of that. Maybe I'll move to be part of that health system or part of that company. And we do that through one-on-one coaching, doing team workshops, and then doing keynotes like this about all things leadership and people and culture. But the reason I'm here today is I want to talk about the hidden risks that you can't engineer away. I'm going to tell you stories like I just told you there. And before we go any further, after a big night last night, by the sound of it, which is always fun in a conference. But some of the stories I'm going to talk about today, because we're talking about the hidden risks. In this day and age, I think it really is best practice just to give you a heads up. There are a couple of stories that will mention people who died by suicide, and I understand that can be triggering for some people. So I've just got a slide up there on the screen, and just wanting to let people be aware of that as I talk through some of these stories. I share these stories really intentionally because I believe that what we can learn about the hidden risks that can be there in a team, in an organization, and in a system, we need to stop and understand them better for the sake of not just the patients, not just the staff, but for the sake of you, these people in the room. So it's really important. Today I'm going to cover 5 hidden risks. So every one of them is, and what I'll say is one thing, I have a slide at the end as well, but I usually do this whenever I'm speaking, is if you are interested in my book, Step Up or Step Out, which is all about how to have difficult conversations, how to deal well if you have a difficult team member, a difficult boss, or just anyone that you're trying to work out how to have difficult conversations. There's a QR code. If you would like, you can download that for free, the ebook today. So I'm going to talk about 5 hidden risks. Every one of them we want to illustrate with a true story where someone had information, but the system for some reason couldn't hear them. So the 5 risks I'm going to talk about. The first one is what I call the knowledge cliff. What happens when critical knowledge lives in one person's head? Second, we're going to talk about silence and what happens when people try to speak up, but the system actually shuts them down. Third, the expert trap. What happens when you promote your best technician and lose your best technician and actually lose a functioning team sometimes? It's called the expert trap. Fourth, culture. This is what happened with Betsy's story. The right protocols, the right systems. Probably some of this, literally the smartest people on the planet were within a couple of kilometers of this place, and yet what went wrong? How did it go so horrifically wrong? Culture. With the right protocols and the wrong culture, you can still see serious mistakes. And fifth, the weight your people carry. And this is the risk nobody talks about. The weight people carry in the healthcare industry. And so I want to talk about that as well. First thing I want to do, though, as we as we talk about the knowledge cliff is I just want you to turn to the person next to you and or someone near you, and I want you to just count up between you how many years of experience you have across your career in the industry you're in. So if you're an engineer, if you're a supplier, whatever it is, how many years of experience do you have in what you're doing? Turn to the person next to you and share that, or if you need to share with someone else, turn around in groups of 2 or 3. How many years of experience? Okay, has everyone had a chance to share? If you haven't shared yet, other person, say how many years of experience? Okay. So, I want you to pick 2 of you, if you're in a group of 3, just pick 2 of you, and I want you to combine those years. So between 2 of you in whatever group it is, pick the highest amounts, and I want you to combine those. So if one of you has 15 years and the other person has 30 years, your total would be 45 years. Okay, has everyone got a total for your group? Okay, so put your hands up if your people you were connected with had more than 10 years experience. Put your hands up if more than 10. Keep it up if it was more than 15, more than 20, more than 25 years experience, more than 30, 35, 40, feel like an auctioneer, but I'm not auctioning anything off. 50 years experience, 55 years, 60 years experience, 70 years experience. Anyone over that? Wow, okay. 75? 75 years experience. What, 80? No, 80 years experience. Give him a round of applause. Yeah. 80 years, that's incredible. Between you, 80 years of experience. When I talk about the knowledge cliff, one of the hidden risks that you don't think about when it comes to any team, any organization, any culture, is just how much knowledge is in your head or in the head of the person next to you that may or may not be written down. There's a really famous story where the US, as part of their nuclear program over the past 30 years, 40 years, 50 years, there was a point where they needed to kind of rebuild something they hadn't touched for 20 years. And so as they went to rebuild this, they got out all the documentation. I mean, they've spent billions of dollars over the years on this program. And so they do all the pieces one by one. They start putting it all together. It hadn't happened for 20 years. The engineers who were around when they had done this particular part of the program had now retired. And as they built everything out, they found there was one thing that didn't work. Everything else worked as per the manual. But when they put all the pieces together, one thing just kept not working. And it was this, excuse my complete lack of engineering knowledge, I'm going to really embarrass myself here. A nuclear material. Okay, well, that's not that bad. I can't get that too wrong. A classified nuclear material, so we don't really know what it is. It was referred to as fog bank. I don't know why they gave it such a weird name. Fog bank. Everything else worked, but when they followed the instructions and made this little nuclear material as part of this program, fog bank failed time and time again, and it was stuffing up the whole thing. So over 2 years, they said, we're going to have to kind of go back to the drawing board and find out why this isn't working. They spent $69 million in 2 years. $69 million to solve what on earth was going wrong with fog bank. In this case, what they found was, after trying every conceivable solution, someone at last said, a couple of years into this, wait a second, this is probably a crazy idea, but what if there was something about the environment they were making it in, because this was 20, 30 years ago, and there's something in the environment that was affecting, that we haven't factored in. And what they found is that their actual systems they were using following the documentation now were too clean. There was actually something about the setup they had that now modern cleaning materials were getting rid of that was a key ingredient in FogBank. So it was actually just how clean our current, the current systems are that was breaking FogBank. Doesn't sound like a big deal. It cost them $69 million. Another interesting one, which I love when talking about the knowledge cliff, is a soybean oil company. So there's this soybean oil company, and they're making massive amounts of soybean oil, sending it all around the world. And there's one maintenance technician who walks in and walks up to the machines, and he gets this 50-cent seal that they use as part of the process, and he applies that. And he does it week after week after week, just one of the many, many things he did at that plant. But finally, he retires. So sure enough, according to management, nothing changes. Hire another maintenance person to take over and do what he did, and off we go. But suddenly, these massive, massive amounts of soybean oil, when they go for their first testing after being made, are failing. And it starts costing them tens of thousands, hundreds of thousands of dollars, until it's millions of dollars that they start seeing over months and after a year. And they cannot work out. Once again, everyone is on it. They're checking every process, everything that's documented, and they cannot work out what on earth is ruining this soybean oil time after time after time again. In the end, what they found out is that in the documentation and in the manual, this 50-cent seal was changed every 8 weeks. But this legend maintenance technician, just because he was exceptional at his job, he was consistent and committed to what he did, he had learnt from hands-on experience, this needs to actually be changed every week. That seal isn't lasting as long as they say it should. And so he had just, off his own bat, decided, I'll just do it weekly. So while he was there year after year, decade after decade, he's just there every week, consistently changing this, and then he retires. And because of that 50-cent seal being changed, going back to being done 8 weekly, the company loses millions and millions of dollars. So I believe every team and every organization has its own fog bank, that you have your own soybean oil 50-cent seal. So what I want to ask you is this. What is the thing in your team that only one person truly understands? And what is your plan for when they leave? Amy Edmondson is sitting in William James Hall, the psychology building at Harvard. She's staring at the screen of her old Macintosh. She's a doctoral student. And she's just spent months distributing surveys to hundreds of doctors and nurses in 2 nearby hospitals. She's measuring teamwork quality across different units. She's been riding her bicycle to the hospital every time a major medication error is reported. She interviews the caregivers involved, and she's trying to understand what went wrong with this medication. She's collected 6 months of error data, and all she has to do is put the 2 data sets together and confirm what everyone around her already expects from this project. Better teams will make fewer mistakes. It had worked that way in aviation, so it should work that way in hospitals, right? She's not trying to make a major discovery. She just needs a finding. She's a doctoral student. She needs something clean, unsurprising, just so she can finish her doctoral program. She runs the analysis. The numbers populate the screen. There is a correlation between teamwork scores and error rates, and it is statistically significant. She leans forward. The line is going the wrong way. better teams in hospitals were reporting more errors, not fewer. The data is saying the exact opposite of what she had predicted. So she sits there staring at the screen and this sinking feeling hits her stomach. The anxiety begins to spiral. She thinks about Richard Hackman, the Harvard professor whose cockpit crew research. She's meant to extend this research into healthcare. She thinks about a pediatric surgeon who's trusted her with his data. And so she thinks about dropping out of grad school. But the anxiety won't let her walk away from the data. It forces her to think. Perhaps, she later wrote, that anxiety forced me to think deeply because she knew her survey data was sound and she knows the error data that she'd picked up, it's all been collected carefully. Therefore, the question isn't what went wrong in this data. There must be something else going on. What if good teams do not actually make more mistakes? What if they just feel safe enough to report them? What if good teams don't actually make more mistakes? They just feel safe enough to report them. The realization forms right there on her old Macintosh screen in William James Hall. Better teams aren't more error-prone. They've just built environments where a nurse can say to another nurse or to a doctor, I made a mistake, without fear of being punished. The weaker teams have the same errors or worse, but no one is speaking up. And so the only difference is whether mistakes are visible. But having this insight is a long way to proving it. So when she rides her bicycle back to Leap's office with a new interpretation, the same bicycle she's been riding, every time a patient gets hurt, he actually is really skeptical. She's the novice. Everyone else has a degree in medicine or nursing, and so she has this sense of failure that deepens. But his skepticism turns out to be a gift because she ends up getting another person to come in and be a double blind. And basically what he does is he goes and he spends days in each unit. He quietly watches how people interact, comes back with a stark finding. The units are wildly different as places to work. Some of them talk about mistakes openly, and other units, nurses say, if I make a mistake, it means you get in trouble. You feel belittled like a 2-year-old, was how one person described it. So Edmondson asked Andy to rank the teams from most to least open, and his ranking nearly perfectly correlates with the data. The units where people felt safe to speak were the ones reporting more errors, not because they made more mistakes, but because they felt safe enough to make the mistakes visible. So this is when Amy Edmondson stumbled onto the concept that we've all heard about, that she called psychological safety. So she published her paper in 1999, and since then it's spawned 1,000 research papers. And Google, who have done multiple studies on culture and on teamwork, which is always really interesting when they do, because they bring 10,000 data points from their massive teams. They found when it comes to team effectiveness, number one predictor of team effectiveness, psychological safety. So they've actually measured that at scale, and in a massive CRICO strategies analysis of nearly 24,000 malpractice cases in healthcare, they actually found that communication failure, so this psychological safety, when it's not there, people go to speak up but they don't. That was a factor in 7,149 cases. And they sound like just numbers, but that lack of communication led to 1,744 deaths. And this is something that I work on with teams all the time, because one assumption you'd make if we think about a hospital You know, when you unfortunately find yourself in a situation where you're the patient, you have to visit a hospital. Teams always think that in a hospital setting, the place where things would go wrong, like where miscommunications would happen, I don't know, for me, I think it's got to be the emergency department. Like, those places are so stressful, particularly when I'm there with my, I remember taking in my, my 1-year-old and knowing I was going to have to wait however long, and it's just so much happening. You think, well, if anywhere there's going to be miscommunication, it's there. Craziness, people, lines coming in, and yet what they actually found is it was only about 8% of the cases were in those emergency situations. A vast majority of the communication errors that led to 1,700 deaths happened in the ambulatory, like in the clinic, in the slow moments where people are coming and going. And the reason this happens is that it's in those emergency rooms, in the crisis of the moment, where actually we communicate best. Because in those moments, it forces us, okay, we have to get this right, this person showing this. And so those settings, as counterintuitive as that is, actually creates better communication. And so one of the best things you can do in your team is to make sure that what you're working on in your team and in your organization has what we call, what Patrick Lencioni calls in leadership circles, he calls it a rallying cry. It's like a thematic goal that how can we take what we're working on as a team, which may not be the equivalent of doing CPR on someone in the emergency table, like it might be something that seems really dry. How can we create enough clarity around it so that we're so clear on what we're trying to do by when, that we're actually, we never want to manufacture a crisis, but you do want to manufacture that level of clarity and communication and intentionality that you do see in situations where there is a crisis. And so sometimes the most dangerous risk in a system is not a mechanical failure. What if it's silence? So I want to ask you this question. In your team, in your organization, in your system, would your newest employee feel safe telling your most senior leader that they're wrong if it was a crucial moment? Think about that. Would your newest employee feel safe telling your most senior leader that they're wrong if it was a moment where it had to be said? January 13, 1982. There's a snowstorm in Washington, D.C. Washington National Airport's been closed for snow removal, has just reopened. Air Florida Flight 90, which is a Boeing 737, is sitting on the tarmac with 74 passengers and 5 crew. They're waiting to taxi. In the cockpit, Captain Larry Wheaton is in the left seat. First Officer Roger Petit is in the right seat. Roger Petit's 31 years old. The wings have been de-iced, but the plane's been sitting on the ground for 49 minutes since then. Snow's been accumulating the entire time, and the engine anti-ice system has actually been turned off. Neither pilot switched it back on. Petit can see something is not right. During the taxi, he mentions the ice 4 times. But each time the language he uses is oblique. Observations, not orders. At 3:59 p.m., the aircraft is cleared to take off. Wheaton sets thrust, the plane begins to roll. Through the cockpit windshield, the runway is barely visible because of the snow falling. The wings that were de-iced 49 minutes ago, they're white again. Petit is at the controls, and he looks at the engine gauges and says, "God, look at that thing. That doesn't seem to be right." That's literally what he said. "God, look at that thing. That don't seem right, does it?" It was exact words. "Well, that's not right." But the senior pilot says, without even thinking, yeah, it is. There's 80. No, I don't think that's right. Maybe it is. They're still accelerating. Wheaton calls out 120 knots. Petit says, I don't know. The plane rotates, it lifts off the runway. The stick shaker activates immediately, but the aircraft barely climbs. The ice on the wings destroys the lift of the plane. And at that moment, Petit finally drops the deference. This 31-year-old talking to the more senior co-pilot. And in the last seconds of his life, he says what he should have said minutes ago. He says, Larry, we're going down, Larry. And heartbreakingly, Wheaton replies, I know it. And the aircraft strikes the 14th Street Bridge over the Potomac River, hits 7 cars, breaks apart, plunges into an ice-covered river. 70 of 74 passengers, including Larry, including Petit, they don't make it. 4 motorists on the bridge die. And when you hear that story, you think it must be something greater that mechanically went wrong. But the truth is, it was the dynamic between those 2 pilots that cost 70 passengers, 70 people on that plane, their lives. Every time he packaged what was a life or death warning in the language of polite uncertainty. That don't seem right, does it? It's not the same sentence as, Captain, we cannot take off. So the gap between those 2 sentences doesn't sound like much. That don't seem right, does it? Captain, we cannot take off. But 78 people's lives were lost in that gap. So your junior engineer who says, I'm not sure this looks right, at 2 a.m., they might be trying to tell you something that is a critical incident. They might have said it twice already. How do you build the type of culture in your team and your organization, in your system, where you make sure that at those crucial moments, people are able to say the things clearly that save lives? And the statistics are interesting. It's a very human thing. 85% of employees have withheld important safety information from their manager. So if you looked at your near-miss reporting data from the last 6 months, would you be confident that it reflects reality, or would you be seeing your team's fear? The next culture, or before I get to culture, sorry, the next hidden risk I want to talk about is what's called the expert trap. And the thing about the expert trap is another one of Google's great, literally 10,000 data point, shouldn't sound US, should I? 10,000 data point analyses. They actually started off when they did what they called Google Project Oxygen. And I love this because I know all my mates who are engineers. I can see, just to stereotype a bit, I can see, that one of my mates, she would 100% say this. Their first thing they started with was, okay, well, let's look at the importance of managers, and let's start off by saying, do they even matter? And so they said, let's go back. Let's not look at what really makes a great manager. Let's start by saying, do you even need a manager? So they worked on these teams, ran all these data points. Unfortunately, it showed, yes, you do. The manager really does matter. And when you didn't have a manager, it was drastically less effective. But what they came up with over the coming months and years, they ranked 8, eventually they expanded it to 10 traits that make a great manager. So I want you to turn to the person next to you and I want you to guess where technical expertise would sit. So we have these traits, eventually they went out to 10, but when they first did it, there were 8 of them. Where do you think technical expertise sat? Is that the number 1 trait? To be a great manager in software engineering and Google, your technical expertise, if you've got that, that's number 1. Number 2, number 3, 5, 6, 7, 8. Turn to the person next to you, what do you think? Where do you think it landed? Okay, so who said 1? You reckon it was first? 2, who reckons it came in second of 8? 3, yeah, a few people saying probably 3, maybe not most important, but right up there. 4, in the middle somewhere. 5, not the most important, top 4, but 5th, there's other things that are less important than that. 6, 7, so not the least important, 7, and 8. So it actually came in number 8. So within Google, and remember, these are engineers. They didn't like this data. They wanted it to be higher. But what the expert trap should tell us is that sometimes when you promote your best technician, what gets you promoted because of your technical expertise is actually the least important thing to make you a great manager. That's really, really hard to sit with. And to make it even worse, what can happen is if you have an amazing technician and you promote them, and now they're no longer on the tools doing what they love to do with their technical expertise, you lose a great technician. And often, because if they, about 82% of leaders in some recent research are given these roles with no management training attached. You're a wonderful individual contributor, you have amazing technical expertise, now manage a team. And more than 4 out of 5, after all the years spent getting technical expertise in what's made them so great, are given no technical expertise around leadership and management. And so what ends up happening is you lose your best technician, but sometimes you also lose an effective team because they don't have the training to run a great team. And that is called the expert trap. It's a hidden risk that we need to be aware of. So I went through these. This is a really important phrase that I believe in from Charity Majors, CTO at Honeycomb. We need to change how we think about promotions. Because if someone is talented in the technical expertise, then maybe keeping them in that role is actually what's best for them, for the team, for the company. And the shift we need to make, Charity says it really well, if management is not a promotion, then going back is not a demotion. And it's not just in healthcare engineering, it's across so many different sectors. We need to change how we think about this. Okay, the 4th hidden risk is that culture eats strategy for breakfast. And we've heard this, you've probably heard this, it's often attributed to Peter Drucker. But I won't spend long on this here, but the best example of this happened in VA Pittsburgh, because there was a hospital there that actually created the protocol for dealing with Legionella. So you have a hospital that created and contains the experts who wrote one of the first protocols for Legionella. And yet, after 5 years, it was discovered they'd had Legionella in their water supply. All the while, they wrote the protocol, they've been using the protocol on paper, but 6 veterans ended up passing away in this hospital because of Legionella. And what went wrong had nothing to do with the accreditation, nothing to do with the protocols, because accreditation and protocols without accountability, sorry, I'll go back. Accreditation and protocols without accountability, without the right culture, that's the fourth hidden risk. Tony Jenkins' wife is calling. It's midnight on April 10th, 2018. Sharon Jenkins is sitting in her house in Lake Macquarie. Her phone's in her hand and she's pressing redial. The line rings and then there's silence. She hangs up and presses the button again. She's calling New South Wales Ambulance. This was the organisation her husband had worked for since he was 26 years old. She'll call 17 times before she stops. 17 times between 12:30 a.m. and 4 a.m. And I need you to hold that number because I want to rewind to the beginning of the story. So don't let go of this number 17. Tony Jenkins is 54 years old. He's been a paramedic for 28 years. So if you've ever had that worst day of your life where something breaks or someone you love needs urgent medical care, Tony's the guy who comes through the door. This is what he does every day as a paramedic. He shows up when the rest of us are falling apart, and he holds the situation together. And he's been doing this for 28 years since he was 26. And there he is on April 9th. He's mid-shift, but he gets called into a meeting. There's no advance warning, no explanation, no support person for him. No one takes minutes. And there's no recording. But in that meeting, even though we don't know what was exactly said, we know that Tony Jenkins was accused of stealing fentanyl from ambulance stations. Think about that, what that means for a paramedic. His whole professional identity is built on trust. Patients trust him with their lives. His colleagues trust him with controlled substances. But now, all of a sudden, in a room, no witnesses, no documentation, someone tells him that trust is gone. No one contacts HR, no one contacts the psychology unit, no one contacts his family. It's just this one meeting, this accusation. And then a senior officer drives Tony to his car at the Belmont ambulance station and drops him off alone, 4 hours before his shift was supposed to end. Within 2 hours, Tony Jenkins is dead. His body is found the next morning, still in his New South Wales ambulance uniform, in bushland near his home. He was 54 years old, and his toxicology report comes back. No fentanyl, no alcohol, no drugs of any kind in his system. So whatever happened in that meeting, whatever was true or untrue, there's a deeper question, which is what happened after the meeting? What was the follow-up plan? Who was assigned to check on him? And the answer, unfortunately, is nobody. And this is why the phone calls are so heartbreaking. Because Tony's wife, after watching him as a frontline paramedic for 28 years, she knew something was wrong. And in the middle of the night, between 12:30 a.m. and 4 a.m., she picked up the phone. He was meant to come home at 10 p.m. from his shift, finishing. And she tried getting onto someone at New South Wales Ambulance. She called once. She called twice. She redialed the 5th time, the 7th time, because she knew something was horribly wrong. 15 times, 16 times, Sharon Jenkins called and called. But nobody answered, nobody called her back. And she eventually begged a John Hunter Hospital employee to ask other paramedics if they knew where he was. And all they could tell her was that by then that there had been an incident. A manager will call her, and he doesn't. She ends up calling her daughter, Sydney, at nearly 4 a.m. And later on in 2023, New South Wales Ambulance was convicted and fined $187,000 for breach of duty of care. And so this is what I think we need to be aware of in your industry, is that there is a weight that you carry in the healthcare industry. And so when you find yourself delivering difficult news or having a difficult conversation with someone that could be career-ending and career-defining, our responsibility doesn't finish at the end of that meeting. We have to be proactive about how we follow up and how we understand. And I want to ask you this question. After a difficult conversation with someone on your team, or maybe it's a colleague or someone adjacent, when's the last time you followed up, not to manage the situation, but simply to check that they're okay? So that's the fifth hidden risk. Healthcare is the number one industry with the highest mental health compensation claims in Australia. Did you know that? And over the past 10 years across all industries, there's been a 161% increase in mental health compensation. And so I want to ask you about the weight you carry. Because a lot of you are engineers or technical experts. So here's a stat for you. The average time when someone has to take time off work for psychological injury is 34.2 weeks. So all of us would be all over it if we broke our leg. You know, a broken leg, I know exactly what I'm going to do. 8 weeks plus a whole system of support. But when we don't care for those around us or ourselves, a broken mind, when we allow it to get to that point, if we don't seek help, 8 months. Right? Isn't that crazy? Plus maybe a pamphlet. And this is what a paramedic said, but I think it really applies for you in your industry. We are conditioned to be the help, not need the help. So who checks on the person who keeps everything running? Okay. As I wrap up, I just want to share one more story to close. I know we need to move to morning tea. So the last story I want to share, I really wanted to finish this talk by saying that I see you and that what you do matters. And I don't believe you probably hear that enough in your roles. In 2024, my wife was 38 weeks pregnant. It was 1 week before Christmas, and I woke up in the middle of the night and I went to the sink, and I remember I was really thirsty. So I turned on the tap and I just splashed water, and I remember thinking, this is strange. I've never been so thirsty, like where I'm like, I'm like, wow, what's going on? And so 1 week away from having our second child, I went and got a blood test, and my GP sent me a message to say, Jonno, come in, ASAP. So I sat down with my doctor and he said, your blood sugars are, mate, they're through the roof, and your cholesterol is up there with it. And that combination is a walking heart attack. We need to do something ASAP. And so in that moment, a week away from having our second child, all of a sudden, I was diagnosed with type 2 diabetes. And fast forward a week, Giovanna, our beautiful little girl, was born. And that was at the Mater Hospital in Brisbane. And, you know, Giovanna, my son Roman, my wife Liz, they're the reason I do what I do. I just love them so much. But I just wanted to finish with this because so often you don't get to meet the patients. You don't get to be the nurse or the doctor who stands there and waves goodbye to someone whose life they have literally saved. But I believe that Giovanna, and oh man, she's just the most beautiful little thing in the world, isn't she? You know, we have had such a great experience in the Brisbane healthcare system since December 2024, and I honestly have been amazed, and I keep saying to people that the quality of healthcare that we have has probably saved my life, and also the quality of healthcare we had around Giovanna's birth. And so I can't do this for everyone. I wish I could. I wish I could surround you with all the patients who could turn to you and say, because of what you did, because of your product, because of how you kept that thing from happening, that crisis from happening, I'm here, my kids are here, my grandkids are here. But all I can do is just to say, I can just say thank you. So I see what you do, I see that it matters, and I just wanted to finish today by saying thank you for what you do. I truly, from my heart, appreciate it, and so does Giovanna.